Thank you, Evie team, for sharing the video. So once again, good evening, everyone. My name is Dawn. So your NC for this evening session. So first of all, I would like to thank EVG Global Network and my upline for introducing Elite Career into my life. I would also like to thank all of you for taking your time to join us this evening. So just to highlight again for those who are your name right is not being renewed, or if you can't hear, please check with your friends, okay, and do try to rename your names lah, so that we know who you are also. All right, so before we begin, our AV team has actually put your Zoom on mute to allow the session to run smoothly without any interruption. So later on, we will actually have a Q&A session. So if you have any question, you can actually unmute to voice your question. But of course, if you do not wish to on your mic, you may actually use the chat function to type in your question. So picture will be displayed during the presentation. So if you can't see clearly, you may zoom in for a clearer view. Thank you so much. Yeah, so actually medical science is so advanced nowadays, but why are we seeing more and more hospitals, community centers, nursing home, or even hospice wrapping up more beds? And shouldn't the advancement, does medical science help to decrease the number of patients? And actually, why can we see more and more people in the age group of 30 to 50 detected with cancer? So what should we look out for in cancer? And what is the difference between medical and preventive science? So I'm sure you want to find out more, and that's why we are here today. So let me invite the speaker for this evening to share the topic, the silent killer, cancer part 2. Let's welcome Darren.
Hi, good evening, everyone. First of all, I'd like to thank EVG Network and my upline. My name is Darren, and thank you for taking time to attend this event. So today's topics on cancer prevention is a continuation from last month's webinar. And if you need to review the webinar from last month, you should be able to get a recorded link from the friend who has invited you here today. We always advocate prevention over cure, and cancer is a slow progressive disease. And 2/3 of the time, cancer cannot be detected till it has progressed to the late stages. That is generally only when there's about more than 1 to 2 billion cancer cells in the body. So this is the reason why we need to share with everyone the importance of cancer prevention. So when we encounter someone suffering from cancer, the first thought that usually comes to mind is usually, like, how did this person get this cancer? Is it hereditary? There's always this common myth that cancer is normally inherited. This myth goes like, if a member of the family has cancer, such as like, breast or bowel cancer, the risk of this cancer may be higher. However, there may be some truth to this theory. So if a parents have cancer, their children are more likely to get it. Why is that so? It's more due to similar lifestyle choices between the parents and the children. That is an example, eating habits and preferences. Children usually follow the eating habits and preferences similar to the parents. And cancer resulting from genetic inheritance is actually very low. You can see these depicted slides that even both parents are unaffected carrier of cancer gene, there is only 1 in 4 chance that the 1 child of the 4 children will be affected by the cancer gene. So if you're a parent, do watch your lifestyle habits, as this is the most important factor which your child or children will look up to and follow. So I believe everyone does agree that prevention is better than cure. To prevent cancer, we have to understand other main causes of cancer. Firstly, unhealthy eating habits and living habits accounted for about 70%. So nowadays, people frequently stay up late, indulge in oily fried foods, which, although very delicious, some of them are carcinogenic risk factors. Secondly, cancer caused by infection or virus is about 20%. So example, hepatitis B can cause cirrhosis of the liver and may lead to liver cancer. And lastly, 10% is due to other factors. So the first factor being unhealthy eating and bad lifestyle habits. Let me dive into the food portion. So animal-based food, be it meat, seafood, dairy products, lack fiber and contain animal hormones, high in saturated fats and contain animal protein. So research shows that animal-based food increases the risk of breast cancer, prostate cancer, pancreatic cancer, colorectal cancer, and many other diseases, including cardiovascular disease. So recent statistics shown cancer patients are getting younger, and most of them favor animal-based food, fast food stuff, over plant-based food. Next, why is deep fried food a carcinogenic risk factor? The simple answer is in the smoke point temperature of the oil used. So once the oil temperature has reached smoke point, the oil starts to break down. And the smoke producing toxic carcinogenic substance called maltodextridine, in short form we call it MDA. The common Asian cooking methods such as stir frying may have oil reaching as high as 190 degrees Celsius. Hence, it's always safer to use cooking oil that has smoke points of over 200 degrees Celsius. When the same oil has been reused, for example, for deep frying purposes or for stir frying, the MDA level, which is carcinogenic substance, will increase by 10 times or more. It's known in multiple research papers that patients that are suffering from lung and breast cancer have high level of MDA. So the little table here actually illustrates the usual cooking oil we use at home. So example, like sunflower oil has a smoke point of 107 degrees Celsius. Olive oil and corn oil has a smoke point of 160 degrees Celsius. Therefore, actually these oils aren't exactly suitable for high heat cooking due to the low smoke point of lesser than 200 degrees Celsius. So I believe most of us who are busy working adults often patronize hawker food for convenience sake. But we won't know if the hawker has reused the cooking oil or the cooking oil has very low smoking point. So maybe we should reconsider, frequently consuming this hawker food. Yeah. Consuming preserved meat put one at high risk of cancer. This is due to the nitrate and nitrites being added as preservative. And this usually react with other substances in the meat and form nitrosamines, a carcinogen. So example of preserved meat, bak kwa, yeah, a lot of people like it, bak kwa, right? Hot dog, sausages, Chinese sausages, and even salted fish. These are examples of preserved meats. All these food products has nitrates or nitrites to increase shelf life without refrigeration. However, nitrosamines forms in our stomach when we consume it. Study shows that those who eat mostly preserved food have about 20 to 50% higher risk of colorectal cancer compared to non-eater. Studies also show that preserved and smoked food increase the risk of stomach cancer. Still on the first factor that the animal food lack fiber, this can cause cancer as well, lack of fiber. So why so? Fiber is essential for maintaining a healthy digestive system. It maintains good bacteria in the intestine. So lack of fiber may hinder the body from flushing out toxin quickly. So when this happens, right, toxin may get in contact with the body cells for a longer period and thus a higher risk of the cell mutation. So research has shown that lack of fiber can cause colorectal cancer or colon cancer or esophageal cancer. Scientists have compared vegetarian with meat eater. So the risk of stomach cancer, lymphoid and hematopoietic tissue cancer, multimyeloma, and malignant tumor is higher than that of the vegetarians. Refined food, yep. Examples of refined food would be, like refined sugar, white flour, salt, coloring, and other additives. This is somewhat going to be a shocker for a lot of us here, as these are some of the food we have been consuming on daily basis. So tumors are known to thrive in the low oxygen and high blood sugar condition. This gives people who generally do not exercise or experience breathlessness or eat lots of sweet food a higher risk of developing cancer. Research has shown that eating 100 grams of refined sugar in just one sitting can drastically lower our white blood cells' ability to destroy invading germs, leaving the body vulnerable to infection. So if you must have something sweet, try munching on fruits or drink fruity beverages without adding sugar. So experts say that natural sugar found in fruits make excellent and healthy substitutes to refined sugar. So although there's no link between sugar and cancer, refined sugar contain empty calories that provide only energy and no nutritional value. Empty calories are bad because excessive calories leads to weight gain, which increase the risk of multiple diseases, including cancer. Obesity increased risk of cancer. Why so? It's known that obesity increased risk of cancer, because fat cells in our body has the ability to raise insulin and protein levels and may in turn lead to uncontrollable growth of certain cells in the body causing cancer. So an obese person has a 10% higher risk of getting cancer compared to a person who is not obese. So above mentioned, above all the other mentioned are all the lifestyle factors. So next one, smoking. Yeah, smoking increased risk of cancer. I think a lot of people know that. Tobacco smoke suppress our NK cells, which is the natural killer cells. So numerous types of cancer has been found to be related to smoking. Example, lung, oral cavity, tongue, larynx, esophagus, pancreas, bladder cancers, etc. So many cancers. It's found that men who smoke are twice as likely to develop last stage or late stage prostate cancer. Okay. Children who are exposed to tobacco smoke for a prolonged period of time have about 4 times higher risk of getting lung cancer later in their life than those parents who were non-smoker. So smokers have greater risk of all kinds of cancer. I have to repeat this again for all the smokers. Smokers have greater risk for all types of cancer. Okay. Okay, next. Alcohol suppress our natural killer cells and increase risk of cancer. Alcohol damage liver, increase risk of liver cancer and breast cancer. So prolonged indulgence or abuse of alcohol can increase risk of head and neck, mouth, throat, pharynx, larynx, and esophagus and pancreas cancer. Next, I believe everyone of us experience some kind of stress from time to time, from kids to working adults from time to time, basically. Example, kids and parents having to handle home-based learning these days, during the lockdown or things like that. So psychological stress secrete a substance called corticosteroids, which is a carcinogenic toxic hormones. Yeah. The immune system ability to fight off antigens can be reduced up to 80% within half an hour. It's found that many cancer patients experience some kind of very severe stress just about 6 months to 2 years before their onset of the cancer. So next one, lack of physical activity can actually also cause cancer. As we always advise, a healthy lifestyle should always include some form of exercises. Healthy lifestyle, yeah. Next, sleep. Sleep is equally important for a healthy lifestyle. So lack of sleep can cause cancer as well. Why so? Sleep deprivation results in low production of natural killer cells. Thus means it will promote tumor growth. Lack of NK cell also means reduced ability to fight viral infection. A lot of time when one has sleep issue, it can be due to the melatonin or can result in reduced in the melatonin. Having reduced melatonin stimulates the spread of hormone-related cancer. So studies have shown that the just lack of sleep for about 2 to 3 hours in a week will weaken the immune system. So now let's look at this another cause, free radicals, which are molecules that are highly reactive to the human body. It actually steals electrons from other molecules, causing oxidative damage. So when this molecule become unstable, not only will they damage the cell membrane, but they will also delay cell repair. So why do people in their 30s look like they're in the 50s? Sometimes you see some people looking older than their age. This is because free radicals can cause organ damage. The scariest things about free radical is that the interference it causes to the genetic of the cells can lead to mutation and formation of cancerous cell. So why does the body produce free radicals? When we eat fried food, for example, when we smoke, when we eat alcohol, when we drink alcohol, etc., our body produces free radicals. A lot of people may think, well, no, I don't smoke, I don't drink, and I don't eat fried food, so maybe I'm safe from having free radicals issues. Sadly, no, not true. So you see, if you don't smoke, you still breathe in the secondhand smoke, right, around you, and there's always air pollution in our surroundings. Example, there's this industrial air pollution, there's the automobile exhaust, there's smoke from the fried food, and the body will also produce free radicals. Also stress. When we are stressed, the body will also produce free radicals. Even prolonged exposure to sunlight, mainly due to the ultraviolet rays, the body will also produce free radicals. So in conclusion, production of free radicals in our body is almost like unavoidable. So one may wonder, doesn't that mean cancer is unavoidable? So from the previous webinar, we learned that cancer cells are caused by mutation in our own cell, meaning we can't get infected with cancer by another cancer patient. However, 20% of cancer are caused by viral infection. For example, 80% of liver cancers are caused by hepatitis B virus and hepatitis C virus. So nasopharyngeal cancer is caused by Epstein-Barr and 99% Epstein-Barr virus, and 99.7% of cervical cancer is caused by human papilloma virus, which is HPV in short. These viruses are transmitted through saliva and blood. When these viruses destroy bodies' immune system, they become cancerous. Perhaps you may think that the new coronavirus can remain infectious on many surfaces for 8 hours or more. So will this coronavirus cause cancer? Well, although there's no data so far that the new coronavirus can cause cancer, what we do know is that cancer do not occur overnight. Take, for example, an incubation period of about 10 to 20 years is required for cancerous cells in the lung to fully develop into lung cancer. So it's now been confirmed that a person infected with new coronavirus will have fibrosis in the lung. As a precaution, of course, it's best to prevent cancer. As a precaution to prevent cancer, it's best to avoid any kind of viral infection at all as much as possible. What are other carcinogens out there? Okay, exposure to sun is one of the main causes of cancer, skin cancer. It's recommended to apply sunscreen to protect your skin if you want to be in the sun for more than 20 minutes. Also, there are chemicals that we come in contact almost every day. Do you notice forming bubbles in our daily necessities, such as toothpaste and shower gel? This is because many of them contain this thing called SLS forming agent. There are also a variety of facial cleansing products and cosmetics which contain tricosans, and these are all chemical carcinogens. Research also confirmed that they accumulate in human adipose tissue. Such toxin can be passed on to baby from a breastfeeding mom, and infants and toddlers' liver, which are not yet fully developed as adults. They lack detoxifying enzyme and thus will accumulate toxin within. So let's look at other carcinogenic factors. Have you noticed some thrifty people who will tend to cut away moldy portion of food, such as like vegetables, fruits, and bread, and then consume the rest of the portion that they assume, oh, it's not affected by the mold. So moldy food actually contains this thing called aflatoxin, one of the most toxic mycotoxin. So high temperature cannot destroy it. Such mycotoxin can actually cause a liver, stomach, and pancreatic cancers. So do be aware to discard any kind or any moldy food, including portion which doesn't seem to be moldy or affected, but you never know, it may already be contaminated by the mycotoxins. So some people love to eat fermented food as well. Fermented food may contain contaminants such as bacteria that that make tempeh, which are harmless to healthy people, but harmful to people with compromised immune system. Fermented food are more known to cause stomach, colorectal cancer, and nasopharyngeal cancer. So another example of fermented food include kombucha and fermented tea. So American Cancer Society pointed out that it contained harmful bacteria and side effect and the side effect of these bacteria are metabolic acidosis in the liver and kidney, which can lead to death. Prescribed medicines are meant to deliver very specific effects and treatment for specific ailments. However, drugs come with side effects. Sometimes such side effects are even more dangerous than the positive effects it's supposed to deliver. Yeah. Some drugs, for example, immunosuppressive drugs such as steroids, work primarily by weakening the immune system response. Studies found that 6 to 8% of kidney transplant patients develop complications and cancer as a result of taking the immunological drugs such as steroids. So treatment for menopause-related diseases such as hormone replacement therapy may increase the risk of cancer by up to 40%. Next, Chinese medicine, which has the common myth that it doesn't cause as much or even zero side effect as compared to Western medicine. Let's take for example Chinese knotweed, also known as He Shou Wu, which is a popular remedy for restoring hair color. So do you know that as little as consuming 1.5 grams per day will cause liver damage? Hence, regardless whether it's Chinese or Western medicine, everyone must practice caution taking medicine, as every medicine has side effects. So during this pandemic, many brands of vitamins claim to say that improve immunity and prevent viruses. However, there has been no concrete study proving that vitamin pills can prevent or treat viral infection. Instead, there has been a lot of extensive research showing that this artificial supplement can in fact increase the risk of cancer. So what is that? So when all these vitamin supplements are said to be extracted from very natural sources. So we understand that when we consume a plant food in a wholesome manner, such as carrot or tomato, it can reduce cancer and nourish our eyes and protect our vision because it contains beta-carotenes and a variety of plant nutrients. But when we extract beta-carotenes from carrots and turn it into vitamin A pills, our body may experience overdosage of vitamin A and the immune system loses its balance. There's already plenty of studies showing that taking a wide variety of artificial supplements increase the risk of cancer. So take for example, vitamin A. Vitamin A can cause osteoporosis, liver damage, fetal damage, and increase the risk of lung cancer. Vitamin C causes DNA damage and cancer. The study also found that folic acid supplements may increase the risk of prostate, lung, and rectal cancer. The difference in taking the artificial supplement pills is equivalent to like force feeding our body with supplement dosage. This is very different from the way our body extract vitamins from consuming wholesome food, where the body will actually extract by itself the right amount of dosage at the right time. Take for example an orange, which everyone knew contained a wealth of vitamins, including vitamin C. However, when we attempt to extract vitamins, say by making orange juice, fresh orange juice out of an orange, we are in fact causing the orange to oxidize, releasing billions of free radicals during the process of juicing it. The outcome is in fact mostly natural sugar drinks without most of the plant nutrients as compared to when it's in the wholesome form. So now imagine the similar process happening in vitamin pills manufacturing plants, where vitamin C pills were being chemically extracted out from orange. No doubt it will be the purest single form of vitamin C in a single pill, but the harmful effect definitely will going to be outweigh the positive when the body is unable to extract the correct dosage and the other plant nutrients. So it's like the body will be force-fed with the inaccurate dosage together with the oxidation process releasing the free radicals, resulting very undesirable effects. So if you think you need to take vitamins, do consume it from wholesome food, which is complete and balanced, and there will be no side effects, no matter the quantity taken. So have you heard of people having used side effect after taking multiple orange or multiple apples every day? I believe the answer is always no. Yeah. With today's advancement in medicinal science, we still see that such speed of advancement is no match for the speed of the mutation and infection rate of disease and viruses. So preventive science is the only safeguard against today's disease and virus. Nutritional immunology is a preventive science which can help us safeguard against such diseases and viruses. So let's now look at the nutritional immunology. So what exactly is nutritional immunology? So 90% of diseases are related to malfunctioning of immune system. What is immune system then? So our immune system is actually the best doctor in the world inside us. It's like an army within our body protecting us against diseases. So when our immune system is healthy, it can perform three major functions: defense, cleanse, and repair. The immune system is akin to a powerful army, defense functions. So the picture on the left is the B cells, which are capable of producing antibodies to fight bacteria, viruses, as well as cancer cells. So B cells are capable of producing more than 1 billion different antibodies to fight invaders and also have memory function. So when it encounters the same invaders, it will produce the required antibodies to destroy it within 24 hours. Now let's take a look at this slide. This one in red, yeah, that's what we are most fearful of, a cancer cell. So the white cells surrounding it are what is our natural killer cells, NK cells, natural killer cells. So the role of natural killer is to detect and destroy cancer cells, and they do this without causing any side effect compared to other treatments, like example, chemotherapy. This picture on the left are cells that are transforming to cancerous cells. So NK cells have the ability to sense cells which are transforming to cancerous cells and seek out and destroy such cells. Next, let's take a look at this slide. The NK cells is delivering a kiss of death to destroy the cancer cells and continue to hunt for other cells. So after being destroyed, it will then become a waste product and will be excreted out of our body. And this brings us to the next function, that is the cleansing function. So this picture you see on the left is a macrophage. So the garbage man of the body, so-called. It has extendable tentacles to hook up and swallow viruses or infected cells. Then after that, it will be excreted out of the body in the form of phlegm or mucus. So the one on the left is another type of macrophage in our blood vessels. The macrophage will move forward and engulf green particles that's usually our HDL, cholesterol, or triglycerides, and the remains of cancer cells, whereby it will then be excreted out of body through a bowel movement. So next, this slide shows our repair function in the process of repairing the damaged tissues and organs in our body. Have you wondered why some people's wounds heal more quickly than the others? Well, it all depends on the capability of our repair functions in our body. So according to nutritional immunologists, our immune system needs a variety of nutrients to prevent cancer caused by different factors. So people now say do not contract diseases due to a lack of basic nutrients such as protein, carbohydrates, fats, vitamins, and minerals. Rather, more than 90% of the diseases are caused by malfunctioning of the immune system. So after more than 30 years of research in nutritional immunology, it's found that providing our immune system with three main nutrients, which is phytochemicals, antioxidants, polysaccharides, is the key to boost the immune system to fight diseases and to achieve longevity. So first, let me introduce some of the cancer fighter. Rhapsody, which has more than 10,000 phytochemicals, include cactus, American ginsengs. Okay. Research shows that the ingredients in Rhapsody inhibits growth of new blood vessels in cancer cells, stop tumor growth, neutralizes cancer-causing hormones, and has anti-inflammation properties, defense against bacterial, viruses, and cancer. Immunity. It has a variety of polysaccharides. So ingredients include cordyceps mycelium, maitake mushroom, shiitake mushroom, ABM mushroom, Cassioptera, and blueberry. So since 1960, scientists in Japan discovered that polysaccharides in mushroom. It has the ability to increase NK cells activity by 49 folds, destroy existing cancer cells and viruses, inhibit tumor growth, and can prevent benign tumor from becoming malignant. So how to antioxidant from plants destroy free radicals? So free radicals are highly unstable molecules that cause oxidative damage by stealing electrons from surrounding molecules, thereby interfering with the stability of a cell DNA, causing damage that may lead to cancer. They are produced when the body breaks down food or by cigarette smoke, toxic chemicals, and excess sunlight, as well as body-owned metabolism. Antioxidants are substances that donate an electrons to the free radicals, thereby preventing the free radicals from causing mutation from cell DNA. Next cancer fighter, rosy thyme, rich in antioxidant. So ingredients include cactus fruit, Acelora, cherry, rose, and cranberries. So it has antioxidants that prevent free radicals from interfering with DNA, slowing down aging, and protect body from UV damage. Enhanced collagen production also means prevent cancer metastasis. Yeah. Next cancer fighter is raisin tree, which care for your liver. Ingredients include Ovina dosis, which most people know it as Oriental raisin tree, American ginseng, and monk fruit. So liver has more than 500 functions, which include stopping the tumor growth, detoxifying and filter toxin in the blood, as well as cancer-causing hormone. It's able to regulate cholesterol, blood pressure, fats, and uric acid, and reduce inflammation. It can also increase alcohol metabolism, burn fats, protect our liver, and prevent liver inflammations. Yeah. So as well as prevent the fatty liver I've mentioned, and liver cirrhosis and liver cancer. Next cancer fighter is berry beets, and it nourishes your heart and liver. So ingredients include hawthorn, blueberries, raspberry, and cranberries. One of the richest source of antioxidants and nourish macrophage in our blood vessels. It can neutralize free radicals in the body, protect the body from free radical damage that cause tissue damage and aging, as well as to stop tumor growth. It's also able to prevent breast cancer, cervical cancer, and inhibit growth of liver cancer cells by 50%. Next cancer fighter is a final source of protein. It is soy. So it provides all essential amino acids needed. Soy protein has 2 times higher content of protein than meat, 3 times higher than eggs, and 12 times higher than milk. It contains carbohydrates and vitamins, rich in minerals such as calcium, iron, and phosphorus. High in fiber, that is including insoluble and soluble fiber. Low in calories and free of saturated fat and cholesterol. Next cancer fighter is soy phytoestrogen. Soy contains natural phytoestrogen, mainly isoflavone and lignans. Phytoestrogens quickly bind to cells' estrogen receptors, keeping cancer-causing estrogens from promoting the growth of malignant cells and lower the risk of hormone-related cancer. Furthermore, the isoflavones in soy genisteins have anti-cancer effects and have shown promise in preventing breast, colon, prostate, and endometrial cancers. Next cancer fighter fiber up is psyllium husk. So our body actually requires about 20 to 35 grams of fiber daily. It has this psyllium has soluble fibers which form a protective layer to protect our intestine, preventing excessive absorption of fats and calories, and it's weight control. Studies have shown that serum husks can lower cholesterol and blood sugar level as well. And for the insoluble fibers, which is a natural cancer, promote bowel movement, shorten the time that toxins are in contact with the intestinal wall, thus reducing the risk of cell becoming inert. So studies have shown that serum husk fiber promote the growth of healthy bacteria in the gut as well, and it inhibits growth of cancer cells and lower the risk of colorectal cancer. So according to researchers, the path to health and longevity, one needs to have a strong immune system. And to have a strong immune system, one needs to ensure sufficient sleep. And rest will be able to boost up, sleep and rest will be able to boost up our immune system. So during our sleep, our body cell actually goes into the process of repairing damaged cells and at the same time eliminating toxic substances. So there was once a study where two groups of people injected with hepatitis A vaccine. So 4 weeks later, those who have sufficient sleep have 2 times more antibodies than those who have insufficient sleep at night. In addition, deep sleep actually also allows the brain and muscles to relax. Maintain stable emotion. So be happy and think positively all the time. Set a very simple but motivational goal every day. Find your preferred way to relax and relieve stress. Stay optimistic and open-minded. The reason is because when we are stressed, our body secretes hormones called corticosteroids, which suppress our immune system by up to 80%. Moderate exercise. So exercise moderately increases the flow of blood and oxygen to the tissue and inhibit tumor growth. Exercise also stimulates sweating and deep breathing, which enhance lymphatic circulation and help the body to expel toxin and stimulate NK cells activity. So research shows moderate exercise increase body temperature and enhance the function of white blood cells. Help cancer patients maintain normal muscle mass and enhance the survival rate. So lastly, to have a strong immune system, one needs to have a complete and nutritious balanced diet. If we can achieve all these 4 criteria mentioned above, we will be able to maintain healthy and prevent cancer. So American Society Cancer Research and World Cancer Research Funds in a 660-page report suggested that the most effective way to prevent cancer is to consume whole grains, legumes, and legumes is beans, and food containing dietary fibers at least 30 grams, and 5 portions, at least 400 grams of a variety of vegetables and fruit daily. And this will be the most effective way to prevent cancer. So I believe prevention is better than cure. So maintaining a healthy immune system starts from our daily life. So the above is my sharing. I wish all of you good health and happiness. Thank you.
Thank you so much, Darren, for the wonderful sharing. So indeed, nutritional immunology science is actually preventive science. So like what Darren had shared just now, prevention is always better than cure. So having more phytochemicals, antioxidant, and polysaccharide nutrients will be the best to boost our own immune system. And on top of that, we must fulfill the other 3 factors, which is sufficient sleep and rest, appropriate exercise, and also stable mood. So if we can meet the above criteria, we will actually certainly get a stronger and healthier immune system. So actually for the second part of this session, is there anyone actually win back his or her health after consuming the product? So yes, we do have. So basically this lady is actually only in her 20s, but she has a lot of health problem, and I can say that it's really a nightmare for her. So I shall invite her to share her journey on how she win back her health through nutritional immunology, plant food. But before I invite her, I would like to seek everyone cooperation by not taking any photos or personal videos during the testimonial sharing. So now let's welcome Melody to share with us.
Hello everyone. I'm Melody. Right, thank you for having me here today. Right, so I used to have some health issues, such as having irritable bowel syndrome, which is IBS. I have bloating. I have urinary tract infection, which is called UTI in short. I have sinus, acne, and fatigue. And I was also like underweight. So this IBS, right, and the bloat gave me the most pain because I had to get off the train to catch toilets almost every single morning, and that makes me late for my class and subsequently my work. And due to my very sensitive digestive systems, my diet had also been very, very uninteresting. No chili, no coconut, no curry, no fried food, no cold drinks, no nuts, no beans, and so on. Yeah, and it's a must-have for me to carry medicine whenever I'm outside, and I'm constantly worrying about my guts giving me problems. Yeah, so I keep showing up at clinics for medication, but since they don't really like help much, I decided I should self-help through eating like light meals, exercising, eating a wide variety of health supplements such as vitamin C, multivibes, food enzymes, manuka honey, supplements for liver, he shou wu for my hair, and so on. Right, so these are supposed to help improve my immune system based on the written descriptions on the label, and and from what I read from the internet lah. Yeah, so I had to spend like hundreds on these items, these products, but the results were not quite satisfactory. So one fine day, I went to the doctor again due to my bloating issues, and he sent me for the pelvic screening after feeling something hard in my abdomen. So the results came back. My right ovary, right, was way, way, way bigger than average reading. So please hold on, and yeah, I can share my readings with you. Yeah, okay. So basically, right, the readings it's okay, sorry. Okay, so basically, right, from the right ovary, right, the sizing is 19.3, 15.8, 14.4. It's a lot bigger because a normal ovary is probably like 3 cm in dimension. Yeah, so that was how big it is. Yeah, and then yeah, he said that it's the largest cyst that he has ever seen, and it was almost as large as a ruler. I don't have a ruler, so yeah, this is almost like the size. Yeah, and I needed an operation. Yeah, so that was when my colleague actually recommended I should seek the help of my another colleague's wife who knew the science of nutritional immunology, and I did. And I accepted the idea of taking high antioxidants for recovery boost, and I started to take the high antioxidants in very large quantity to prepare for the surgery. So now I'm going to show you some of the very real pictures that was taken during the surgery, and it might make you uncomfortable so yeah, just be mentally prepared. Yeah, so during the surgery, this is what they have found inside my body. Okay, so this is the first cyst that I have. Yeah, so basically the doctor is trying to help me to drain my cyst. And then subsequently, right, it was discovered that I have another cyst. So this is the second cyst. And then thirdly, this is during the surgical procedure itself, right, we discovered that there was endometriosis. Yeah, something else, the bubble. And then yeah, so this is my ovary, my right ovary. It's no longer like whole. And yeah, the end result is the left ovary looks normal, but the right ovary is barely there. Yeah, so that was what happens during the surgical procedure. And then yeah, after the surgery, the surgery, right, this is the finding written by the doctor from the medical report. So basically, will it recur? Okay, for the cyst, yes, there's a chance, although it's rare, but for the endometriosis, right, it can recur. It can come back, basically. Yeah, so what is the impact? The impact is that I'm off like sub-fertility, which means that I might not get pregnant in future, like there's a possibility. And that it also may come with pain. And then what are the solutions that are given? First thing, observe law. Just continue to observe. And then the second thing is to put me on contraceptive pills. So these are the two options or solutions that I'm given. Right, and yeah, so what is endometriosis? Endometriosis, right, happens when the tissue similar to the lining of the uterus will actually grow outside the uterus. And then I don't know, it's happening to me as well. It's only discovered during the surgical itself. And then when after the surgery, right, when I'm brought back to my bed, my whole body wow, hurts a lot. It feels like needles, needles piercing through every bones of mine. So I'm so in pain. And then yeah, please don't touch my body. Wow, it's very painful. So I was like shivering very badly due to the side effect of the anesthesia as well. Then I felt like helpless after the operations because what I can do is like I can only like lie in the hospital bed. I couldn't do anything. Then I have to be like dependent on people to get around. Now this is obviously not something that I wanted to go through again. Then I was then like prescribed with this contraceptive pills. It's called Yasmin, and it serves as a like preventive measures to help me to regulate my body hormones so that to avoid the growth of the future cysts. But to be honest, at the back of my mind, right, I know that I must tackle the root problems, right? So through the recovery days, right, I was still consuming the high antioxidants in large amounts, and I'm also like doing like walking to expel the gas from my body, and I'm also resting. And I realized I don't look as frail as my colleague who came over to see me because he's recovering from a fever, but I look better than him. Yeah, yeah, and thankfully, right, my study schedule I could still go on as planned, and I could also like start work earlier so as not to burden my colleague. Yeah, all this right is possible thanks to knowing nutritional immunology. Through the nutritional immunology, right, I learned that our body system, right, are correlated. So a problem in only one body system of mine, right, which in my case is the reproductive system, can lead to complication of so many other systems in the body. So obviously, right, I can't base on the fact that, if let's say my head hurts, then I treat my head. If let's say my legs hurt, then I treat my leg. Yeah, I shouldn't do that lah. And that's why I actually move on to try the complete nourishment series to tap on its complete, safe, and effective nutrients so as to overhaul my body and not be reliant on the contraceptive pills and medicines, which may give long side effects in the long run, right? So yeah, so let me show you what I'm taking. Okay, so this is the complete nourishment series that I took, and I also like took Solpro as well, right? And yeah, to be honest, right, I wouldn't really say that it's like an instant recovery because I also understand that I have lots of health problems. So I persist through revamping my whole body system through the food therapy. And after that, I see obvious results. The IBS reduced, the sinus also reduced, and then I have much lesser UTI now. And I have more energy level. My stomach also gets stronger so that I can enjoy my food better. So a year later, I actually took the blood test as well, and it shows that my fertility, there's a reading. This reading, right, the figure is actually much better than average, right? And my womb inside is also clean, and I'm able to like grow a healthy baby inside, right? So through knowing nutritional immunology, it returns me a lifestyle that I should have, right? And it also gave me like less worry and much more enjoyment. And then now I don't have to like hunt for toilets. If I go out, I'm also able to like eat a wider range of food in my favorite roti prata with curry. Yeah, yeah. And during my pregnancy, right, I was also on this complete nourishment series to help me and my baby growth. And I observed that his growth progress, right, had been faster than average. He's really like starting to walk at 9 months plus, and I sort of understand what we tell him to do and not to do. So this is the picture of my son. Yeah, okay, so this is the picture of my son, right? So basically, yes, he's learning to walk at 9 months old. Yeah. So from what I know, right, normally kids, they would only like start to learn to walk when they are almost like 11 months. So he's almost like 1 month plus ahead, right? Yeah, so he's already learning to walk. And yeah, basically this is how I look when I'm pregnant. With the weight gains, I don't actually quite look like overly chubby. Yeah, because I actually opt for the wholesome fruits instead of like taking the artificial man-made supplements, right? Typically, we will actually get from the gynae, like the multivibes, folic acid, and fish oil, etc. Right? Yeah. So yeah, okay. So the I realized that child, they only like grow up wise, and as a parents myself, right, I also want to give them like a good health foundation, not only for him to learn and play, but also to spare me for worrying about him so that I can continue to concentrate better on my work. And the way to maintain a good health had been easy for me and my families and my friends as well, because we can simply place our order online, and then this food can be delivered to our doorstep. So it's like so convenient and can save us a lot of time. Yeah, so last but not the least, I would like to thank Dr. Chen for coming up with such a wonderful health products to safeguard me and my loved ones' health so that we can continue to enjoy the things that we do. Yeah, with that, I end my sharing. Thank you.
Thank you so much, Melody, for sharing with us your testimonial. So really congratulations to you for bringing back your health. So her baby is very cute, right? Yeah, so cute and healthy right now. So actually, indeed, like what Melody had shared just now, actually our health is actually our wealth. So we actually must never ignore small symptoms which our body is trying to tell us. So we must actually find the root of the problem and nourish it with the right fighting nutrient, as mentioned by Daryl just now also during the sharing. So right now, we have a disclaimer here. So every product is actually specialized, formulated to nourish the overall body, including our immune system. However, our products are not in any way a form of medication or drug and should not be used to treat or cure illnesses. Thank you so much, every team. So actually right now, we are going to have our Q&A session. So as what I mentioned just now, if you do not wish to on your mic, you may use the chat function to type in your question, or you can also unmute, introduce yourself, and then ask your question. So let's also limit one question per person. So just now in the chat box, I actually saw this question. Just let me read it out so that everybody would know. Okay, so it's by a gentleman. So he said here, may I know why some doctors advise cancer patients going through cancer treatment to avoid taking ginseng? Yeah, so thank you so much for asking this question. So I would like to check with Q&A team. Is there someone who can answer this question?
Hi, Don. Okay, I'm Charlie. Yeah, allow me to address this question.
Sure, thank you so much, Charlie.
This is actually a very interesting question. So why some doctors, right, actually advise their patient going through cancer treatments to avoid taking ginseng? Okay, first up, you probably have to look at what type of doctor to begin with. Okay, and also you have to look at those renowned clinics in America, plus a lot of research are also telling us the same thing, okay, which is ginseng is actually good for cancer and help speed up recovery, as you can see what Darren has actually explained earlier in the slides. Okay, and also let's also take a deeper dive into ginseng. Okay, in fact, there are actually a few types of ginseng. We have the red ginseng from Korea, which has more stimulating properties. Okay, we also have the Jilin ginseng from China, which has more gentle properties. Okay, and also American ginseng from America, which has more anti-inflammatory properties, which a lot of people uses the word cooling effect, cooling effect, 比较凉, in Mandarin. Okay, so moreover, okay, we have never come across any scientific evidence, right, stating that ginseng actually causes cancer. Okay, however, we have come across scientific evidence stating that people with cancer recover better and faster with ginseng. So by now, you are probably actually scratching your head now, why some doctors, right, advise cancer patients from taking ginseng. Okay, as you know, ginseng is a herb. Okay, you probably heard before doctors advise their patient not to take any herbs when they are sick. Correct. So, okay, the main reason is because, right, there are actually no herbs classes in medical school. So for doctors, instead of taking the time, right, to look into exactly what an herb is, instead of looking into research or looking up exactly what this herb is, therefore, the best advice is just to tell them, right, don't take it. Just tell the patient not to take it because they're not sure. Because, right, they are also not entirely sure how it's going to affect the body. They don't know if it's going to interact with any medication that the patients are already on or anything like that. Okay, yeah? Okay, speaking of herbs, they can actually be split into two broad categories. Okay, give me a second. Let me put up some slides for you for better understanding. Can you guys see the slides? Right, okay. So speaking of the herbs, okay, so as you can see from the slide, right, food herbs and medicinal herbs. Okay, food herbs are things like you can easily get it from the supermarket, like rice, beans, fruits and vegetables. Okay, these are the food we eat every day, and we can eat it with no worries at all. There are no side effects. Okay, however, okay, medicinal herbs are something that we want to be more careful about. Okay, for example, herbs like ephedra, right, can be used as poison. Tobacco is considered a medicinal herb, and we all know smoking is bad for health. Okay, also medicinal herbs also comes with side effects. Okay, so what we have to do to stay healthy is to consume a wide variety of food and vegetables, right, which have a lot of nutrients like phytochemicals, antioxidants, and polysaccharides. Okay, this will actually provide the daily nutrition our immune system requires. Okay, and also help in recovery when a person is sick. Okay, so to help you understand, to basically, right, I understand, that whenever a doctor or professor initials is actually attached to a person name, we tend to follow whatever they say. Am I right? Okay, so to assist you better in understanding who to seek proper advice from, okay, let's take a look at the few medical professionals that we often come across. Hang on. Okay, the first one is actually doctors. Okay, we often come across doctors. Okay, doctor's profession, right, is to diagnose symptoms and prescribe medication or surgery to control or treat the symptoms from getting worse. Okay, second, pharmacists. Okay, if you want to know what sort of side effects coming from medicines, then you have to ask a pharmacist. Okay, the third one is a nutritionist. Okay, if you want to know what are the basic nutrients, right, from food to keep our body alive, then you can ask a nutritionist. Okay, but take note that being alive doesn't mean being healthy. Alive and healthy are two different things. Okay, the last one, okay, the fourth one, nutritional immunologist. Okay, if you want to know what are the foods that can strengthen or weaken our immune system, then you have to ask a nutritional immunologist. Okay, this profession studies the link between nutrition and the immune system. Okay, as you know, right, a healthy immune system can prevent diseases and help the body stay healthy. So just a second. So I hope by now, okay, you actually have a clearer understanding who to seek professional advice from if you want to have a better health, and also know what are the foods that can actually can help a person recover faster when they are sick. Okay, on a side note, okay, are you aware that in a class of graduating doctors, okay, whether their grades are top in class or last in class, they all graduate to become doctors? Are you aware of that? Yeah. So, and also there's also scientific research, right, report to be read daily by doctors, okay, if they want to be updated with the latest information. So so what is reported a few years ago, right, may be very different now. So I hope my explanation, right, actually answers your question. Thank you.
Thank you so much, Charlie, for helping to answer this question. So, okay, I also see another question. Okay, it's actually from Jia Hui. Okay, she's actually asking Melody lah. So I just help to read out first before I invite Melody to share. So she wrote here, congratulations, Melody, and thank you for sharing. Chen is so strong. So hi, can I also check with Melody how you solve your IBS issue? So Melody, can you help to answer? Thank you.
Yeah, sure. Right. My IBS, IBS, the irritable bowel syndrome, right? To be honest, today I also don't know what causes my IBS. Yeah, but I know that I had the issue like for over 10 years. And from nutritional immunology point of view, right, I actually understand that it's not like when I have head problems that I try to resolve the head problems. I have leg problems that I try to resolve the leg problems. So what I did is I just simply went with overhaul, so that I can actually let my best doctor in the world, which is my immune system, do the job for me. Because when I actually don't go to the doctor, none of them can actually help me to rectify my problems also. Yeah, so I just rely on the best doctor in the world, which is my own immune system, to do the job. So this is what I eat. Yeah, so this is the complete nourishment series that I actually eventually go into, right? Specifically, all this 1, 2, 3, 4, 5, yeah, and then as well as the Soy Pro as well, right? And then from there, subsequently, right, I realized that the IBS issue, last time, whenever I eat the wrong food, I will immediately go and rush for the toilet. This is almost like an immediate thing. So there are a lot of things that I cannot eat. But subsequently, after taking the Overhaul series, right, I realized that I start to have like more varieties. And I tried like different food. I tried a bit of curry, I tried a bit of chili, beans, and so on. But okay leh, I don't have like super bad bloating issues. I don't really like rush for toilets anymore. So really yeah, if let's say we couldn't really understand what is happening in our body, right, just go for the best doctor to do the job for us. Yeah, so yeah, that's how I managed to solve my IBS and the many problems. Yeah. Okay, thank you, hope that helps. Yeah.
Thank you so much, Melody. So really like, yeah, I didn't conclude Charlie's questions. I mean the answer also. It seems like what Melody had shared, is because this is nutritional immunology. It's a preventive science, so it's still developed based on the principle of nutritional immunology. So if we want to know what food can actually strengthen our immune system, then we should ask the nutritional immunologists lah. Yeah. So thank you so much. Let me just double check again if do I have any more questions? If not, we will end our Q&A session for today. So if you still have other questions you would like to ask, you can also see out the person who actually invited you today. So right now, let me just give everyone an update for the upcoming activities. Just hold on. Okay, so this is actually the invitation for today. Yeah, so next, okay, we will actually have our study meeting, which is coming Thursday. Yeah, before this Thursday meeting, right, we will actually also have this EVG Global Network training session, which is held on Wednesday by webinar on the 30th of June at 8:30 p.m. So the session will actually be conducted in Mandarin lah, and it will needed to be registered via emails. So for this one, right, it's actually a study meeting. So if anybody would want to know more information, right, do seek out your friend who invited you here today. All right, so next, for this week, we'll have the first sharing from Facebook Live. It will be actually be on Friday, 2nd of July at 9 p.m.